All right. The form is usually an incident report. Some places they call it an error report, but it's often an incident. It's used for falls and anything that goes on that is not unusual, including medication errors. Generally, the person who finds the error is the one who comes in next. And so they're writing the error sheet up. That has over the years been a concern for some people. They don't want to write up an error. They don't want to write it on their friend. They don't want to write it with their name on it because it looks like they did it. But all you're doing is documentation. You're documenting that when you came in, you saw a pill that should have been given the day before. You saw that it was not signed, which it should have been. And so you're just writing that up, and then it will be taken care of. PRN medications, those need to be done immediately too. But what's the difference in a PRN? There's another thing you have to do with a PRN medicine. You take it as needed, but after you document that you administered it or that they took it, there's a second step. It's the time, but then there's a second step. The effect. You have got to go back, and how much time would you give them to see if it's going to work? At least 20 to 30 minutes, because oral medications do not have to, their therapeutic effect does not occur for 20 to 30 minutes, 30 generally. And it just depends. Now, other things like the puffs, if it's to help them breathe a little better, and they're having to take it because it's ordered PRN with extra problems, you can respond to that real quickly. But most times, that's another thing where there are errors because you didn't respond to that. Now, we do have some problems, like they took the Tylenol and went off to work. Well, we have to communicate and get that response then from somebody else. So, medication forms. I think we've handled that pretty much. Let's see if I have. Okay, I'm going to go into one thing that's not in your book. This is something that I'm going to mention so that it's something that is a life lesson, but it's also something you see. We do a lot. Did that go? It did. It jumped another thing. I'll tell you, this computer is on its own. Okay. Antihypertensives. That is, hypertension is elevated blood pressure. So an antihypertensive is a medication that controls, it lowers the blood pressure, so it's used to treat or control high blood pressure. Now I'm using this as an example because you have a lot of residents that have high blood pressure. Does anyone not have a person that has high blood pressure? Or do you have high blood pressure? Okay. So I think it's a good medication to discuss and some things about it. These are things, this will include things that are things you need to observe for when you're working with your resident. Okay, this is just an example. This is kind of how a label would look, or a formulary would look that you got from the physician, from the pharmacist. Apresoline is the name, Catapress, those are both trade names. And do you see that then generic names are in smaller letters like we said they would be? Okay. And do you notice that clonidine is there? And does anyone have a person on clonidine for behavior? Someone said yes. Okay. Well, and now let me tell you what. This is the time to find out why they're on it. Because if they're on it for high blood pressure, then we should be monitoring their blood pressure some. Probably just weekly, not daily, but we need to be keeping up with their blood pressure. But clonidine is also used for behavior.
How would an antihypertensive affect somebody's behavior?
I don't know how. The question is, how does something work when it's on something else? I don't know. But when they learn that, they use them for that. It's the same, it's a side effect.
Is clonidine a vasodilator?
I don't know that it's a vasodilator. I don't know that.
Okay.
But the other thing is, if they're using it for mood and it lowers their blood pressure, they still should have their blood pressure checked periodically, because we don't want their blood pressure to get too low. If they don't need it for blood pressure, it's going to lower it.
But they probably have another one to make their blood pressure go up, right? Taking 10 pills.
Well,
One to make it go down,
yeah,
one to make it go
yeah.
up.
Well, and that is a reality, but it's not as real as you think. You know, how many of them are taking 10 pills? A lot of them? Okay. 85%. Okay, well, I got my answer there, didn't I? Okay. Well, let's just talk about, in straight talk here, that if they're taking clonidine, it is an antihypertensive, no matter why they're taking it. It may be helping their mood, and that's great. But we need to just know that it is what it is. And we know that how? By reading the formulary that comes in with them from the pharmacist. By reading the literature. Okay. Now, anything that lowers the blood pressure, the biggest side effect is this. Low blood pressure. If you're taking something for something else, for lowering it, or you're taking any medicine that's supposed to cause something, if it's too much for you, it may not be too much for the usual person, because that's the usual dose. But if it's too much for you, you're going to end up with a low blood pressure. And when your blood pressure falls down, your pulse increases. So some of these things, this is one reason why it's so hard to treat people with blood pressure issues, because they often don't feel good on their medicine. One reason they don't feel good is because their blood pressure is lower. They're used to it being higher, and they don't like that draggy feeling of it being lower.
Does it make you drowsy?
It says here that it can make this one. Now I'm just talking about these two medicines though. It depends on your medicine. Another thing is that many of the blood pressure medicines have diuretics added to them, and we're going to look at that next. To reduce the fluid, diuretics help you reduce fluid in your body, and reducing fluid automatically reduces your blood pressure. It's actually the first medicine most people are put on. Lasix, anything that happens to be a diuretic. So if it's a combination drug, it's going to do this plus something else. Okay, let's just look. It talks about you might have dry mouth. This is the thing that's most important to know about antihypertensives, is that when you go from a lying to a sitting position and a sitting to standing, it can make you feel dizzy enough that you can't quite get your balance. You do that yourself if you jump out of bed because the alarm went off and you forgot to get up. And you jump out of bed running to the bathroom, we all do, and you feel kind of dizzy. Well, you've done that too fast from lying to standing. It's worse with persons on high blood pressure medicine. It's harder for them for their equilibrium to go from lying to sitting, sitting to standing. And so many times you might have a resident that kind of wobbles or even falls down if that happens quickly. And it's due to their blood pressure medicine. So isn't it nice to know that clonidine that they're taking for mood might cause them to be dizzy and maybe fall down if they don't move slowly, especially depending upon the dosage. And for mood, it might be a higher dosage in some ways, but then this low blood pressure is a bigger problem.
I'd like to ask a question.
Yes.
Can your body get used to the blood pressure medicine?
Yes.
And it won't work?
Okay, what she's asking is getting used to it so it won't work. What would that be? What term is that called? Tolerance. You can become tolerant to medicines. And we do get better with side effects with medicines. If you took Benadryl every day, you would not be as drowsy as you would when you first started taking it. So we do have some ability to get over some of the side effects. You know, with your residents, when they start some of their behavior meds, they, you know, initially are kind of sleepy, but after a while they get better. Phenobarbital causes drowsiness. It is a controlled substance, and it causes drowsiness, but we have a lot of people that take phenobarbital for seizures, and they don't walk around drowsy, and so they do get better. But whether it's tolerant to the point of not being effective is another issue. And so if it's for, let's say, blood pressure, and all of a sudden it's not working as well, you remember the other 99 pills you could try? I mean, a lot of things have a lot of different choices. And that's why it's so important to go back to the doctor. Say, I don't like this one, and let them see what to do. Okay, a diuretic is also used to decrease the blood pressure because it increases urinary and salt excretion. Now, I like to think of that sodium, which is salt, I like to think of that as being a big marble that's being excreted through our urinary system. But when it comes out, a little marble falls out too, and that little marble is potassium. And so on diuretics that are not potassium sparing, like furosemide, which is this example, you will lose potassium. So many people, you just hear this, if they're on blood pressure medicines, they say, I have to eat a banana every day or every other day to keep my potassium high. Because banana is one of the things that has potassium in it. And I'm sure most of you have heard that. Some people actually take potassium because they have to get their blood checked to see their potassium levels. That's another thing about levels. And these are some symptoms. One thing about potassium and sodium is that they regulate our heart rate. So we don't want to lose so much that we have a problem with our heart rate. It says here, sensitive to light, low blood pressure, muscle weakness, and irregular heartbeat. So we need to be careful about losing some of our minerals that we are supposed to have. There's a reason for them. And that's why some people who lose a lot of fluid when they're overheating, they get an irregular heartbeat. Yes?
I was on that hydrochloride for about 6 years ago. And then I went to the VA, I had an irregular heartbeat, and they wanted to put me on pills for the irregular heartbeat.
Yeah, they wanted to put you on potassium.
Why they did that? You know what I'm saying?
Why didn't they do it in the first place?
They wanted to keep on putting me on medicine, and I stopped it now. You know, they Okay, but look, let me just give a scenario of what they were thinking. They were going to put you on something for the irregular heartbeat, but if it was just potassium, that was, yeah, it's another pill, but they could have just said, start eating bananas. But fortunately for you, your blood pressure's okay, you're saying? Oh yeah, it was
only just a little. It was stress.
Okay. They put you on the pills and all that.
Yeah, but don't get yourselves. You do need to respect medicine. I think one of the best things about talking about medicine in this class and how to administer it is that we need to respect medicine. We need to know that just because one pill works well, two's not better. Two can be toxic. We need to do what it's supposed to do, but we also don't need to be where we're not going to ever take medicine because we don't want to take something else. Like our residents that take medication for behavior, but then they have to take something for the side effects of that medicine, like cogentin, Artane, Dramamine, or Benadryl, for the side effects that could occur from that medication. If they weren't on that medication, they would be like they were 40 years ago in the mental health agencies in a straitjacket. So the medication has really good effects, but in order for it to work its best and not cause some side effects that we know could happen, we have to give them something else. But you're right. One of the things with elderly is sometimes the biggest problem they have is they're on too much medicine and they're aging, and it's harder for their bodies to handle it. So we always have to be suspect, but we also have to realize that there's some advantages. I actually was in school when I had to go to Pineville
to the mental health agency, mental health hospital. And
Intern? You were doing an intern?
no, well, it was part of our training. Yeah, I guess we could call it that. And that was an experience. So the main thing here is that, and these are some, like he said, he took the hydrochlorothiazide. That's a real common one for blood pressure. Okay, let's look at something though within our life. And there are a lot of things we can do with some conditions that we have that can be very useful. And he might have done this, is why he now is not on blood pressure medicine. Some of the things we can do is stop smoking. Smoking causes our vessels to constrict. The reason our blood pressure can be higher is because the vessels are smaller and it puts more pressure on the vessels. Because when we talked about vital signs and we said it's the pressure against the vessels, and the top one is when the heart beats. So if you stop smoking, your blood pressure will be lower. And nicotine also is a constrictor. Okay, reducing weight. Good news about weight loss is that sometimes only 5 pounds makes a difference. Did you lose 5 pounds?
Lost 10.
Lost 10, you see?
The doctor said that. He said
Yeah.
2 pounds and you blood pressure. I mean,
Yeah.
what I mean.
Now,
10 pounds?
the doctor was right on that, wasn't he? Okay, so sometimes only a little bit of loss. And this is true with diabetes as well as blood pressure. A lot of times as you become kind of pre-diabetic, lose or borderline, get on that diet, get off those carbohydrates and all those sugars, which we all love, get those white things that we put on our plate, and get on some green and red things, tomatoes and greens and any kind of green leafy vegetable. Okay, so just a little bit of weight loss. For many people, salt is a culprit. Now, I don't know, I mean, I have a sister who really likes salt. So happens it's not affecting her yet, but I wonder. But we can actually reduce the salt without a lot of trouble. It's kind of a habit. And so reduce your salt and read labels and see what has sodium in it. 2,000 milligrams is 2 teaspoons. 2 teaspoons is what we should have in a day. And if you look at soup, it may have 700 milligrams just in a bowl of soup. So look where we are in relation to that. Well, if we ate crackers with salt on it along with our soup, if we eat potato chips and any of those things, so kind of notice where you are on your sodium. And this is the one that I can't seem to do. And I bet you did it to lose 10 pounds, is you increase your exercise. And walking is as good an exercise as running, and sometimes better for you than running, because running can really hurt your knees. So, another thing I want to talk about with your residents in relation to things they buy is skincare. These are the top 5 habits for healthy skin. We do need to protect our skin from the sun, and proactive skincare, skin protection to proper shaving, help you keep your skin youthful and healthy. And I guess sun is the second one. From the sun, smoking is one of the worst things for your skin.
Why?
It makes you look wrinkled, and people who get really wrinkled.
Is that
I don't know
the
why.
smoke getting on your skin or because you pull
No.
it in?
I don't really know.
You
I really don't know.
either?
I don't know. Actually, African Americans have better skin than whites and other cultures.
It's because of the sun. You got the pigments.
You got a lot of pigment to protect it from sun.
Yeah.
And wash your skin gently, moisturize regularly, and shave carefully. And I'll tell you something I've learned. I've never read it. I did read it once, and then I started looking for it and couldn't find it to say this is true. But if you use hair conditioner like you might put on your hair, on your skin, it's very healthy for your skin. Yes, try it for a while and see. He used hair conditioner.
What do you do, leave it on there like a suntan lotion?
No, just put it on and rinse it off while you're in the shower. It makes it very soft, and it's a type of protection on your skin, just like it is on your hair follicles. Okay, we're going to now talk about administering a couple of medications that are a little more difficult to administer. One is eye and ear, and this is the eye, and I'm pointing this out because in your eye, up here is your lacrimal gland, the one that secretes the tears. It's up at the top part of your eye, on the outer part. And the tear comes in and washes across your eye and goes down the tear duct. Okay, so if we know that, then when we administer an eye medication, it should be administered over here. So then it washes across the eye and goes down the drain. If you do it in where the tear duct is, it's not as useful, is it? So if you have eye drops, and we do have, and as our residents are getting older, they're going to be having cataract surgery, which they have eye drops 2 to 3 times a day for up to 8 weeks following their eye surgery. So, and that is something that is very hard for a person to do by themselves. Now you can, but they may have more difficulty. So let's talk about eye drops and ointments. They're used to treat glaucoma, and you may have someone with glaucoma, and they will take them every day for the rest of their life. Or if they have an infection, or pain, or it's another time is after cataract surgery. So here is our procedure of instilling eye drops. Of course, you wash your hands and have them wash their hands, because they are going to touch, and they need to have like a Kleenex in their hand so that they have that in their hand. Warm your drops and shake the medication. Remember, it's a liquid. Do what?
You said warm the drops, okay.
Just in your hand, not in the microwave. I usually clean that,
The drops have to be refrigerated.
yes.
It don't affect the drops when you
And then you have, no. And they don't always have to be refrigerated. Some, like for antibiotics and pain, might have to be, but for glaucoma and for after surgeries, they often do not have to be refrigerated. But the reason is, and actually, I don't totally agree with this, because I think cold drops feel good in the eye. And when you do ear drops, it has to be warm to room temperature, or have your hand, because in your ear, drops affect your auditory nerve and makes you dizzy, and you may throw up. So it's real important to warm ear drops in your hand, but our literature here says to get them room temperature on your hand. And it's true. A lot of things that say warm don't really mean to warm them. I mean, years ago we didn't have microwaves, so you don't remember never having a microwave, do you?
Cast oil in the water on top of the stove.
Well, you can warm them underwater
Yeah.
a little bit, but really just holding them in your hand a little while, because they're always small. Eardrops and eye drops. Now, eye drops, I just personally think one reason they're so small, and anytime you buy eye drops they're going to be small, is because they have to be sterile, or at least clean, and not have any growth in them, because they should be sterile in your eye. In your ear it's not so important, but to put it in your eye, if it's not sterile or at least clean, you can get an infection from the drops themselves. So they just don't hang around.
You don't drop it directly.
Okay, what we're going to do is have them put their face up to the ceiling so their eyes are up, and have them fix a gaze and clean any secretions off their eye, and you wipe from the outer to the inner, and then you cup the lower lid. Make a little cup in the lower lid. They're looking up, and you cup the lower lid. Don't apply any pressure to the eyeball, and you approach the eye from below, and you drop it into that side on the under the under the lacrimal gland. So you see you've made a little cup and you drop it into that eye. You don't drop it onto the eyeball, you drop it into that cupped area, and you don't touch the eye with the dropper. Now, you can, depending upon what the drops are for, you can have them take their Kleenex and put pressure on that tear duct area, and it'll keep it from draining as quickly. But generally, I never see that written on the boxes, and so I don't feel like that's a real important thing. I think it's most important to drop it onto the outer part, not the nose side, but the outer part, so that it goes into that little cupped area, and then it washes across the eye. If you're giving 2 different eye drops, you usually separate them by 1 to 2 minutes, which is a long time when you're standing there. But you've got to get the effect of the first one and not just rinse out that effect with the second one. You've got to wait a little time. And then any drops that are left in the dropper, it says to discard. This is part of your procedure. Now, I have a little thing with that too, because most of the time we don't really have droppers anymore. We have a bottle that drops, so it doesn't really, it's not even an effect there. I mean, it's a non-thing. But if you had a dropper, what you'd be doing is now you'd be putting that back into the bottle. And if you had touched something, you would have contaminated it. And that was the reason for this statement, but I don't see droppers anymore. You follow me on that? I'm not confusing. Do you have a question or just a stretch? Okay. Okay, this is eardrops. Now this is an ear, and the ear has, this is the tympanic membrane, this is the eardrum. So when we're putting medication into the ear, oh, and first, ointment's the same thing. You put the ointment in that little area that you created, the little pouch. Okay. And you don't touch it with the drop, with the tip. Okay. We are putting drops in that run down to this tympanic membrane. Drops in the ears only help this, what's considered the outer ear. This is the inner ear. This is where ear infections are. And so generally, this is not going to help this. Although sometimes you do have drops for inner ear infections, but mostly it's for what's considered external ear infections like swimmer's ear. But we also use drops for wax, earwax. We have some clients that have a lot of earwax to the point where they can't hear after a couple of months. And so, yes, and so we just put the drops in and it just loosens that. As we get older, all of our glands dry up a little bit. And so even the glands in the ears that cause that earwax to stay moist enough that it just leaves, you know, it's got a reason for being. It keeps bugs and things from getting in there. It traps them. But, yeah, it traps that bug, that little gnat. But anyway, and there's hair follicles in there that actually work its way out. What happens is the earwax begins to get drier and the hair follicles, the hair gets longer. And so it actually becomes a problem in there. And so for a lot of especially elderly men, putting some ear drops in there that moisten that earwax and help it just come on out is appropriate. But anyway, okay, so this is the ear.
Do they have, are they against the Q-tips? Using
Okay, yeah.
Q-tips?
The problem with Q-tips is, and I admit that I use a Q-tip and wipe my ear after I take a shower. That feels good to wipe my ear here and maybe in here a little. But if you have wax in here and you stick a Q-tip in, you're just pushing it down here. And the thinking is that it becomes more and more impacted. So we really aren't for Q-tips as far as trying to get anything out. Not anything at all. My mother always used bobby pins
Yeah.
Yeah.
and brought that wax out.
She
But,
got a hearing aid now?
Yeah, well, she's
She's a bobby pin.
I know. It's painful to go too deep, so it
Yeah.
kind of, but yes, that is dangerous. We certainly wouldn't do that.
What about wicking with candles? How's that? Is that safe? I've heard
Wicking?
it's- Yes.
I don't know what that is.
The candle wicking, you stick it in their ear and somehow it draws
The
back
candles
out.
lost
Oh,
in
You
there.
talking about that new thing they got with the stick?
Never heard.
You never heard of that? I thought that was like an older remedy.
Urine now has an ear wash. There's different ear wash things over the counter. And all they have different is when you put the drops in, they also have the little syringe, thing like for the nose
Oh.
suction of babies. What's it called?
Bulb
Bulb syringe, bulb syringe.
Yeah.
They have that and it will, you put fluid in and help wash it out. And that's useful.
Peroxide, say,
Do what?
peroxide.
And peroxide, the reason it's useful is because it bubbles. It's hydrogen and it's oxygen in there. And so that oxygen bubbles as it enters there, there's the oxygen's being released. And it's got another number, it's instead of H2O, it's H2O2. It's got an extra oxygen molecule in it. And so it bubbles and that helps bring it out. Now, it may or may not be good. You might find it good, but anyway, but before we put anything in our residents' ear, they have to have an order. You can't be rinsing ears. You can't,
Turn it inside.
yeah, I'm gonna put a little hydrogen peroxide in there. That's kind of like the client who says, I think their flu would be better. And you say, okay, let's get some flu. No, we have to have the physician say their flu is better to take. So this is if you have an order for something to put in their ear. How are we gonna do that? Okay, because oftentimes there's an infection, and it's, like I say, it's not usually for middle ear, but it could be for external, or sometimes I've seen it used because it against the eardrum corrects the infection that has come onto that drum, or to treat pain. And then our procedure is to allow it to warm to room temperature. And the way I would do that, other than just putting my hand, is if you know you're going to be administering that eardrop in the next 30 minutes, just take